Hi everyone. COVID-19 is not just affecting the respiratory system, it is a multi-system disease. And from the gastrointestinal point of view, it also affects the gastrointestinal system very frequently and very severely in some cases. Unfortunately, in this second wave of the COVID infection, we are seeing more and more cases of GI system involvement. And we have been observing GI system involvement since COVID began. The manifestations of COVID-19 in the GI system include cases of hepatitis, which can mimic completely like acute viral hepatitis. So you would see a phase of anecteric transaminitis, and then you would see a phase of icterus if the patient has jaundice. It can also give rise to asymptomatic elevation of enzymes, which can actually reach thousands. And I've seen lots of cases of thousands of level of liver enzymes in patients of COVID-19. Apart from that, we do see cases of ulceration. So there is GI ulceration. There are cases of acute pancreatitis due to COVID-19, which we have seen. And of course, GI system effects and manifestations include patients of diarrhea, abdominal pain, vomiting. More so in this second wave, we are getting more and more patients presenting with these symptoms and then coming out to have fever, and then they are diagnosed as COVID-19. The treatment of all these cases of COVID-19 GI manifestations is mainly supportive in nature. There is no clear-cut guideline yet on treatment protocols for these patients. Treatment is like for pancreatitis, the treatment is like any other case of pancreatitis with fluid resuscitation therapy, and management of supportive management, prevention of secondary infections, so on and so forth. Similarly, for patients of GI manifestations of COVID-19, we also have certain other symptoms, like for example, we can have patients who have nausea. You can have other symptoms in the GI system where the patient can develop spontaneous vomiting. In all these cases, you have to give the patient supportive care and treatment which is mainly symptomatic in nature. The improvement of COVID-19 would improve the patient's GI system manifestations as well. And fortunately, in a few cases, we have seen that patients who tend to present with GI system manifestations tend to have a milder form of COVID, though this is not the norm in all cases. So that could be a silver lining, but we need more studies before we can finalize that. So as a gastroenterologist, we are facing a lot of patients of COVID-19 who present to us with GI symptoms, and we must keep an open eye for patients who present with such symptoms so that we do not miss COVID-19 in these patients. I think we are all fighting. We are all trying to prevent COVID-19. We are trying to keep our mask on. We are trying to keep distancing, and we are trying to keep our hopes up in this fight against COVID-19. So I hope even with all the manifestations there are, including the GI manifestations, we will conquer this disease eventually. Thank you.